Rhode Island invests $156 million in digital rural health. Rhode Island has secured more than $156 million in federal funding over 5 years to modernize how healthcare is delivered across its rural communities. With a clear emphasis on digital infrastructure, decentralized care, and system efficiency. Announced by Governor Dan McKee, the award supports a statewide effort to strengthen care access while reducing reliance on traditional, facility-heavy models across 18 rural towns. The funding, administered in coordination with the Centers for Medicare and Medicaid Services, represents the first year of a multi-year rural health transformation program. While detailed budgets are still being finalized, the state's approved framework signals a broader shift toward digitally enabled care delivery, designed to improve resilience, manage workforce constraints, and lower long-term system costs in Rhode Island. Decentralized care and community-based access. A central pillar of the program is expanding federally qualified health centers as clinical anchors in rural areas, improving access to primary care, behavioral health, and dental services closer to where patients live. By reinforcing community-based access points, the state aims to reduce avoidable hospital utilization while improving continuity of care for rural residents. Rhode Island also plans to expand hospital-at-home programs, allowing eligible patients to receive hospital-level care in their homes. These models are increasingly viewed as a way to improve outcomes while easing capacity pressures at traditional facilities and lowering the resource intensity associated with inpatient care. Digital and AI-enabled health infrastructure. Health IT modernization is positioned as foundational to the state's rural health strategy. Planned investments include expanded telehealth services, improved data connectivity, and interoperable systems that support care coordination across providers. The state has also outlined the use of advanced analytics and AI-enabled tools to help manage patient flow, reduce duplication of services, and support participation in value-based care models. By enabling more care to be delivered remotely or in home settings, digital-first approaches can reduce transportation demand and limit the need for new physical infrastructure, an increasingly relevant consideration as health systems face cost, workforce, and sustainability pressures. Workforce and community-specific investments. Workforce development funding will support clinical training placements and education to employment pathways in high-demand health fields, addressing persistent staffing shortages in rural areas. Technology-enabled care models are expected to extend clinician capacity rather than replace it, supporting long-term system stability. The program also includes targeted investments for Block Island and the Narragansett Indian Tribe, reflecting a more tailored approach to rural health delivery informed by community input and listening sessions. Oversight will be led by the Rhode Island Executive Office of Health and Human Services in partnership with the Rhode Island Department of Health, with additional implementation details expected following final CMS approval. You've been listening to Sustainability Soundbites by Environment and Energy Leader. For partnership opportunities, please reach out to our team.